Today, we are going to look at a BodyViz Brain Builder about multiple sclerosis. Multiple sclerosis, or MS, is a degenerative autoimmune disease in which the lymphatic system targets and attacks the nervous system. In this Brain Builder, we will take a closer look at the nervous system and the symptoms, causes, and treatments of MS. Our nervous system consists of two parts, the central nervous system and the peripheral nervous system. Let's zoom in on some important structures of the nervous system. 3 different types of neurons are present throughout the nervous system: unipolar, bipolar, and multipolar. Multipolar neurons, the most common kind, have multiple dendrites, one cell body, and one long axon. Picture your hand and arm. The dendrites of a multipolar neuron are like your fingers. Dendrites collect information and feed it to the cell body, which is like your palm in our example. The cell body processes and integrates the information. The cell body will then send that information down the axon, which is like your arm. When the impulse travels all the way down the axon to the axon terminal and is passed to the next neuron via the synaptic cleft, this is called an action potential. Surrounding the neurons in the PNS and CNS are helper cells called neuroglia. Different types of neuroglia perform different specialized functions for each part of the nervous system. For example, in the CNS, oligodendrocytes produce a fatty substance called myelin. In the PNS, Schwann cells produce the same fatty substance for the peripheral nerves. Myelin is a critical component of both the PNS and CNS. This lipid-rich sheath insulates specific nerve axons. Unmyelinated axons transmit an impulse via continuous propagation, whereas myelination enables saltatory propagation, where the nerve impulse moves much faster down the axon by jumping over the myelin. A faster action potential is important for communication throughout the body. Multiple sclerosis is an autoimmune disease that damages the myelin of the central nervous system. An autoimmune disease occurs when lymphocytes, a type of white blood cell and a key component of the immune system, are programmed to attack the body's own tissues. There are many other autoimmune diseases that attack different tissues and organs. In MS, these repeated mistaken attacks gradually destroy the myelin in the CNS, which breaks down motor and sensory functions for the patient. There are 4 types of MS. Clinically isolated syndrome can be diagnosed when the patient is experiencing their very first episode. Normally, CIS will progress to primary multiple sclerosis, in which symptoms progress steadily without remission. Relapsing remitting multiple sclerosis is the most common type and is 2 to 3 times more likely to afflict women than men. Repeated attacks on the CNS cause identifiable lesions on the brain. The location of these lesions is important, as it causes each patient's symptoms to differ. If no more lesions develop, one could go into remission. However, if more lesions develop or symptoms progress after a period of remission, one could go into active secondary progressive multiple sclerosis, also termed active progressive multiple sclerosis. Remember that in multiple sclerosis, the myelin covering the nerve axon has been degraded. Think of the axon as being wrapped in a protective bubble wrap, and then gradually having the bubbles popped. MS is a progressive disease, meaning that the damaged myelin can't be repaired, and as it is damaged further, the impulse speed down the axon becomes slower and slower. Since MS is degenerative, early detection is key, and there is a wide range of possible symptoms. One early, often overlooked symptom is swelling of the optic nerve, which can cause blurry vision, chronic migraines, balance disturbances, or loss of coordination. Other signs of MS include involuntary eye movement and double vision, slurred speech, mood disturbances, digestive upsets, and memory difficulties. Multiple sclerosis can be difficult to diagnose, which is why seeking the attention of a doctor upon the first signs is vital. MS can be diagnosed with the help of an MRI showing lesions in the brain. Retinal imaging and cerebrospinal fluid testing can also aid in early detection. Treatments depend on the severity and the progression of the disease. Anti-inflammatories, steroids, immunosuppressants, and even chemotherapy can aid in stabilizing the disease. preventing further damage to the myelin of the CNS as soon as possible is essential. Let's take a look at a patient example. You receive your patient's file and take a look. Age, 36. Sex, female. Chief complaints, blurry vision. You invite the patient into your office for an examination. You are a clinical neurologist. Over the past 6 months, your patient has noticed increasingly blurry vision, which seems to come and go. After waking up one day with blurry, double vision, she made an appointment with her optometrist. The optometrist observed papilledema, swelling of the optic disc, and possible optic neuritis, swelling of the optic nerve. Upon reviewing her family history and ruling out other possible causes, the patient was referred to you. After a thorough examination, you start with an MRI of the brain and identify multiple lesions. You then order a spinal tap to test her cerebrospinal fluid. Carefully considering the evidence from the MRI, cerebrospinal fluid, the patient's family history, and multiple counts of episodes of vision disturbances, you diagnose her with relapsing-remitting multiple sclerosis. Since there is fairly little damage to the CNS myelin so far, you tell your patient it's good she caught the symptoms early. You prescribe a corticosteroid to reduce inflammation of the CNS, which will help her blurry double vision return to normal and reduce further damage. Finally, you refer your patient to an MS specialist for the best ongoing treatment and support for her needs. This has been a classic example of multiple sclerosis. Thank you for watching this Brain Builder video. Please like and subscribe to our BodyViz channel, or if you are new at BodyViz, check out our other anatomy resources and schedule a demo at bodyviz.com.